Caring for a loved one with dementia poses many challenges for families and caregivers. Without proper understanding of the disease, it is very easy for family members to give way to feelings of frustration, which often leads to burnout. There are programs equipping family caregivers with the knowledge and information they need to assist a loved one suffering from Alzheimer's, dementia, or other memory disorders. A local organization has a caregiver workshop scheduled in the coming months, and the details are coming up on Polk Place. I'm Bill Skelton, and welcome to Polk Place. Joining me in studio today are George Giraldo. He's the CEO and owner of Senior Helpers of Polk County. George, welcome to the show.
Thank you very much, Bill. Appreciate that.
And on the sofa with George is Cindy Klaus. She's the Community Relations Manager with Senior Helpers of Polk County. Well, let's get right into it. We were mentioning different memory disorders. Perhaps you can tell me the difference between Alzheimer's and dementia. And I'll start with you, George.
A lot of times what we see is the umbrella, if you think of the umbrella as the dementia part of it, and underneath that there are various forms of dementias, and Alzheimer's is the most prevalent one. And really what we see is the differences between the Alzheimer's and dementia is abilities to progress in the disease process and how people struggle with the differences. You know, there are other types of dementia, something like Lewy body, that affects someone's behaviors and abilities to behave in certain ways, in different ways than it does from an Alzheimer's perspective. Cindy has some very good statistics for us that I think would help us understand how prevalent this really is out in our community.
Go ahead, Cindy. Give us some of the statistics that kind of lend a perspective to the magnitude of these disorders.
Well, worldwide, 44 million people struggle with this disease. In the U.S., 5.3 Americans struggle. And it is said now that 1 out of 9 U.S. citizens will end up with Alzheimer's at one point in their life.
So currently there's 5.3 million Americans suffering some memory disorder, or is that Alzheimer's in particular?
That's Alzheimer's in particular.
Okay. Now I remember growing up, I'm kind of an old guy, I'm in my 50s. Alzheimer wasn't kind of a household word or diagnosis for memory disorders. There was like dementia and senility. So what really constitutes Alzheimer's as opposed to some of these other memory disorders?
It seems that Alzheimer's is being a more prevalent type of a dementia. The Alzheimer's Association is out there to help support these families in understanding the progression of that disease process and what support is out there for them. It's more of the typical type of dementia as it progresses. It starts off at a form where someone starts to repeat stories, or could be a husband, spouse, or a parent or loved one that starts to really not do so well in their finances. Their memory starts to change, and that's just the beginning parts of it. As that disease progresses, they're actually getting lost in time at a certain point where they look around their surroundings. They could live there for maybe 20 years, but it doesn't look like home to them because in their mind they might be 30 years back in their life. So Alzheimer's being the more prevalent type, it affects sometimes in a very specific manner how it progresses, and what the best possible care is for that person, versus other types of dementia. Some of them are alcohol-induced types of dementias, and some of them are actually reversible. You know, the Alzheimer's being the more prevalent type, we know that it's not reversible. We know that there is not a cure for that just now. So really the focus of our types of programs, they can affect all types of dementias in terms of how we can care for them, but a lot of it is based on the Alzheimer's progression that we know that happens over time.
So generally speaking, are most memory disorders progressive? So you'll actually see I guess a deepening of the characteristics that contribute to the disease?
That is correct, yes.
I think a lot of people worry because as they get a little older, oh, I'm forgetting something, I have Alzheimer's. And I think we start to struggle with that. There's a certain part of normal aging. I'm turning 50 this year. You said you're in
Welcome
your 50s.
To the club.
Yes. And it's interesting because there's a certain part of when we retire, we don't have a schedule anymore. So maybe you don't remember that it's Tuesday because you didn't get up and go to work on Monday, and you don't remember. There's a certain part of normal aging, but when it becomes characteristic, like you're repeating the same thing, not every time your daughter comes over, but mom is repeating the same story 14 times in the same visit, and it does become progressive. I know I worry about people before I knew, they told me that story last time I was here. This is very different. They're telling me the same story many times in the same visit and forget that they've ever told me at all.
So I suspect that you probably make information available kind of in the form of like guidelines that would give people specific things that they could recognize that would alert them to the potential for Alzheimer's or other memory disorders. And maybe the idea is if you see that progression, then maybe you understand that there's a serious issue there.
The best thing that I did when I started worrying about somebody that I cared for, I went to alz.org. It's a great resource, and there are 10 warning signs. And go down those 10 warning signs, and does the person that you're concerned about, are they exhibiting a lot of those warning signs? That's when you need to go to your doctor and seek help and decide if there really is Alzheimer's or a dementia problem present.
Now, when you're seeking medical attention, are you looking for a specialist initially, or would you think a general practitioner, or, you know, let's just regard it as a parent maybe having the problem? Would you take them to their general practitioner, or would you seek a specialist immediately?
I think the general practitioner would be the right place to start, because they can rule out some minor things that could be affecting that person that seems to be a form of dementia. Something as simple as a urinary tract infection that can happen to, or even upper respiratory infection that can happen to many of our aging population, can mimic a form of dementia, the beginning parts of it. Their memory starts to fade a little bit, they're a little bit confused. You clear up that infection and they're back to normal. So I think starting at the primary care physician is the right place, and then from there they can get them out to a neurologist or someone that can really diagnose them a little bit further. But I'd like to take a step back, if we don't mind, for a second on the resource side. Cindy mentioned the Alzheimer's Association, which is phenomenal. We are blessed to have Stephanie and Chris at the local office. And really, a lot of times when it comes to a family member worrying about, you know, what's going on with mom, is it something that I should really be worried about? I definitely recommend that they call the local Alzheimer's Association office, speak to Stephanie, speak to Chris. They have a wealth of resources available to them there to help them not only understand this is something that you should be worried about, here are the steps that you should follow, but here are support groups that are available, here are trainings that are there. If they get plugged into that, they'll have a wealth of knowledge and experience to be able to deal with what's going on in their lives.
Well, how about telling us more about Senior Helpers of Polk County? What is it that you specifically do to help people dealing with loved ones that are having memory disorder problems? How are you equipping them, and what resources are you providing them, you know, to help them with their personal experiences with their loved ones?
That sounds wonderful. Thank you for that question. We've been in business here since 2008, and really one of our main focuses has always been dementia care. It's something that's near and dear to my heart. I lost my aunt from dementia, and specifically Alzheimer's. And it was very challenging, and it was before I owned Senior Helpers. So I saw my family struggle through that care. My mother actually stayed with her, I think it was a little bit over 2 years, being her nighttime caregiver. And I saw the effects it had on my mother. So that always instilled in me the abilities or want to help other folks out there. And what we do at Senior Helpers, we have a program, it's called the Senior Gems Program. And we have these amazing resources that are some DVDs. If anyone's interested, if you go to www.seniorhelpers.com, you're actually able to order one of these for free. And it's a Senior Gems video, and it's based with Teepa Snow. She's a renowned dementia educator, occupational therapist out of North Carolina, and she worked with Senior Helpers to put the Senior Gems program together. And it allows us to understand the progression of that disease process, and not only understand the progression, but how to care for someone in the beginning stages as they're progressing and they're losing their ability to bathe or walk properly or groom themselves. We have a specific skill set on how to approach that person. And that's what the workshops that we're coming up through September that are going to help us with that, in order to understand how do we, could be a family caregiver, could be a professional caregiver, how do we step into the shoes of that person that has dementia? How do we care for them? How do we love them, take good care of them, value them, show them that they still have a lot of worth in their lives, and make sure that they're doing the best that they can at that moment, and just take very good care of them.
Obviously, there's a lot of work in caring for people with memory disorders, whether it's Alzheimer's or dementia. And you talk about the Senior Gems kind of as a reference guide. So it helps folks recognize the potential for these memory disorders, and then it kind of equips them with some things that they can do on their own, at least initially.
That's right.
To kind of to see the person they're giving care to, I guess, through these different stages. Now, what are some of the things specifically that caregivers, loved ones in particular, when they're out of kind of that clinical setting,
right,
what can they do in their homes to kind of, you know, comfort and assist these people with memory disorders to kind of to live a, I guess, as normal life
That's right.
as they can outside of that institutional setting, particularly if they're being cared for at home.
In the beginning phases of the Alzheimer's or dementia disease process, it starts to just as a repetition that Cindy mentioned, someone that's repeating the story. So patience is very, very key,
Yes.
something to have to be able to help this individual. Now, I will say it's very difficult and even more challenging when it's a loved one that you're caring for, because there's that emotional connection to that person, to mom, to dad, or to a spouse. So being patient at that moment when you're hearing the 50th story of how you met or different things that are going on in your life could be a little challenging. That's where a professional caregiver from Senior Helpers, when we come in, we don't have that emotional connection with that individual to that level. So we have a little bit more patience from that perspective, but I think we can teach that to the family caregivers to say, take a little step back. Don't take personal what's going on at that moment. That person is not doing that to get you upset. They're not doing that to try to make you angry. They're doing the best that they can at that moment. So that person with dementia is just trying to survive that day and do the best that they can.
Right. You almost have to disassociate your life experiences with that person.
That's right.
As you're attempting to help them through the process. Now, we were talking about some of the events that you're going to have throughout the summer. I know that something that's associated with the event is a virtual dementia tour. Can you tell us about that, Cindy?
I tell you, I love the virtual dementia tour. What it does is it helps for a small moment of time for you to step into the life of someone struggling with Alzheimer's. We give them aids that will change their vision to mimic macular degeneration and some of the vision losses that people with Alzheimer's struggle with. We give them headphones that kind of explains the confusion that they sometimes experience, neuropathy, all of the different pieces of the puzzle, and we give them tasks to do, and they are sent into a room to do these tasks and try to understand what it is like for a short period of time to be in the actual really shoes of somebody with Alzheimer's. It's a very eye-opening experience. It's good for someone who doesn't know what Alzheimer's is. It can be emotional for someone that has lost a loved one to it or that is caring with, but I think it helps us to better empathize with what they're going through.
So this virtual tour actually mimics some of the characteristics and traits, so the person that's experienced it is having a similar experience to somebody who may have a memory disorder. So they have that
That's right.
disorientation and some of the other physical
Some
traits
of the
that somebody...
discomfort, yes.
So the discomfort. So like you said, I can see where it would build empathy, because people, if they experience the characteristics, can better relate to people who's actually suffering from memory disorders.
And part of the struggles a lot of times for a caregiver, whether it's family or professional, is not knowing what's going on in that person's mind at that moment. And a lot of times coming out of the virtual dementia tour, they just step back and they say, wow, that's the behavior that my mother exhibited, and I know why. I know why she stood in a corner room and was confused, or why she followed someone else in a room and just mimicked and did what they did. So it's amazing, because it does give them an ability to just understand what was going on in that person's life, but not only that, but also change their behavior. It's so difficult to change someone's behavior, and we find that through virtual dementia tour, whether it's our caregivers that go through that training, or the community or professional or family caregivers, they come out and they say, you know what, I'm going to change these next 3 things when I care for my loved one, because I know that I was doing them wrong in a sense.
So if we have viewers that are going to go to one of these events of yours, what kind of life skills or care skills rather can they use? Give us a few examples that
Excellent.
they may be able to immediately take away from these events and use with their loved one or somebody with a memory disorder that they're giving care to.
That sounds excellent. And one of the biggest things that we learned through our Senior GEMS program is how to approach someone with dementia. And we see this happen many times, whether it's in home setting or a hospital or facility, someone that's sitting down and someone approaches them from behind, let's say in a wheelchair, to take them somewhere. Picture yourself not even having dementia and someone just comes from behind you. It's going to startle you. Imagine that person that's confused in a surrounding that they're not familiar with, scared most likely, and they hear a voice coming from behind them to take them somewhere. It's going to startle them. So what we learn is the approach, and what is called the positive physical approach. It's stopping 6 feet out from where that person is, in front of them, making sure that they see that we're coming in, asking for permission, walking up to them, connecting with them, treating them like a human being, treating them with respect, being able to get them to do minor things. Could be for me to help someone stand up that's having struggles with getting up to go eat some dinner at a facility right home. Could be as simple as getting them up so that we can go take them to the bathroom or take them for a walk. as far as bathing, how to properly groom someone that is maybe combatant, maybe doesn't want to take a bath at that moment. How do we get them to, how do we change the environment around them? How do we get them to follow those instructions? Because obviously hygiene is an important part of the aging process. So it's some skills that once you go through there, you're like, yeah, it's common sense. Why don't we do this? As a culture, we don't think as much about how to approach someone positively, but that's what this program teaches us.
It's amazing that you start with something as simple as an introduction or the physical approach to someone, and then it just goes from there.
No good care interaction starts with a bad approach. It's going to go downhill from there if it doesn't start well.
That's right.
Well, we certainly appreciate you being here discussing memory disorders, how to recognize them, how to help deal with them, and we certainly wish you the best of luck in your future endeavors. George, Cindy, thanks for stopping in today and discussing these issues on Polk Place.
Thank you.
Thank you so much. We appreciate it.
Senior Helpers is a trusted and respected organization that takes a responsible role in supporting their clients, families, employees, and community. They invite you to join them for their caregiver workshop and virtual dementia tours at the Highland Park Church of the Nazarene, located at 4730 Lakeland Highlands Road in Lakeland. The workshop will run throughout September. Cost for the event is free, but you must RSVP no later than the day before the event. Workshops include the basics, memory loss, dementia, and Alzheimer's disease, building personal care skills, and the virtual dementia tour, your window to their world. For more information on times and locations of workshops, give them a call at 863-686-7333 or look them up on the web at alz.org FL Gulf Coast.